Welcome. I'm Dr. James Lee Jr., a board-certified orthopedic surgeon, and I'm starting a YouTube channel to assist patients, other physicians about orthopedic surgery in a laid-back environment. One of the topics that we're going to discuss today is the hip. I want to welcome you to a casual atmosphere where we can learn together, collaborate, and hopefully help you reach your goals in your healthcare journey. As an orthopedic surgeon, I see numerous patients throughout the week in the operating room and also in the office setting. In a typical week, we'll see 150 to 200 consults and perform between 4 to 6 surgeries, ranging from what we call arthroscopy or sports medicine surgeries to joint replacements, ranging from total hip, total knee, and total shoulder. Today's topic is hip, and I want to go over some of the relevant anatomy and some of the treatment options that we have for patients that have hip pain. So, let's begin. The hip is a ball and socket joint. Oftentimes in the office, I'll tell people the top of your femur bone is like the scoop of an ice cream, where it's a round ball, and it meets the socket, which is the acetabulum, and it's made of cartilage, ligaments, and muscle. So in order to move one's hip like this way or rotate it, all of these structures have to work together. When somebody comes into the office and says, my hip hurts, we do what we call a physical exam. We examine the hip, we ask them questions, how did it happen? And then we also go over anatomy. How do we do that? Well, in the office, there's a few things that we do. We can get an x-ray. We can also do an ultrasound. And in some cases, if we feel like there's more damage that we can't see on an x-ray, we'll get an MRI. Now, the hip itself, as I mentioned before, has multiple structures. The cartilage is your cushion. That's what allows you to walk smoothly and to rotate and move around. In order to move forward, the muscles around the hip have to actually flex, extend, and rotate. We call that range of motion. And there's also ligaments. Ligaments are basically like rubber bands that keep the hip together and allow some flexibility. The hip itself, because of its nature of being a ball and socket joint, is what we call constrained. It's not going to allow a lot of motion except in certain planes like this way and back and to the side. So if you come in and have hip pain, we think what we call a differential diagnosis. What could it be? There are numerous things it could be. Number one, it could be arthritis. Well, what is arthritis? Arthritis is typically wear and tear, where the cartilage isn't smooth anymore, it's worn down. Most commonly in our practice, it's from aging. Wear and tear that happens from just living life, and the hip starts to degenerate. It's a shock absorber, if you will. And over time, this shock absorber can start to break down. There's also structures within the hip called the labrum, or the labrum is the cushion, if you will. That's a specialized cushion on the rim of the socket. And when somebody tears the labrum, they can feel pain in the hip. And that's not uncommon in sports injuries or people who are in athletic type of activity. One other thing we see commonly in the ER setting is a fracture. Right? We see a lot of elderly patients with osteoporosis who fall and no longer can support themselves, and we get x-rays, CAT scan, MRI, and we can oftentimes see that there's a crack in the bone, and that is something that we see commonly. On the outside part of the hip, there's a bone called the trochanter, and people can get a bursitis or an irritation between the muscle and the tissue, and that usually presents with pain on the outside as opposed to the groin area, which is on the inside. Now, in terms of treatment, it ranges. It ranges from observation, where we watch to see if it gets better. We can try medication. Depending on the patient's allergy history, they can either get something like Tylenol or an anti-inflammatory, or if it's something is broken, maybe something a little bit stronger depending on how severe it is. From there, there's also physical therapy, which is rehabilitation. We work on swelling, range of motion, strengthening to try and improve how you walk, how the hip behaves, if you will. In painful conditions, we do injection. We'll use an ultrasound device. We can locate the hip joint And we can inject medication ranging from steroid, which is not uncommon, and also a biologically friendly one called PRP, where we draw blood, we spin it in a machine, and then we take the, what if you call it, like the vitamins of the body, if you will, the vitamins in the blood, and we inject it into the area where there might be damage or arthritis, and oftentimes that can relieve it. Most recently in our practice, we added a device called shockwave therapy that is essentially putting energy and allowing blood flow to come to an area that's been injured, whether it's a muscle strain or if somebody has really symptomatic arthritis. The shockwave can increase the blood flow, and there's no injection, there's no surgery, and that typically is about a 5-minute procedure. And then lastly, as a surgical practice, we do offer surgery in a subset of our patients. In our practice, our most common hip surgery, most common too, would be a hip replacement and fixing the hip with what we call like a plate and screws if we need to. These are more rare than the other conditions that we talked about, but in certain patients, they do fit the criteria for a hip replacement or fixing the hip if we get the appropriate studies done. In terms of what we do for follow-up, after these treatments are initiated, we will see the patients at 4 weeks, 8 weeks, 12 weeks, and we like to follow progress so that we can see if what we recommended has actually helped. And if it doesn't, then we think of other treatments or maybe another diagnosis to help the patient with their health care. Thank you again for joining me, Dr. James Lee Jr., board certified orthopedic surgeon at Orange Orthopaedic Associates. You can reach out to us online or call us or leave a comment. We'd love to hear from you. Have a great day.